Sawasdee Krap and good afternoon once again. Happy Sunday. Today is Sunday, the 17th of January, 2021. And as usual, the English language summary of the daily press briefing here at the COVID Center, the Center for COVID Situation Administration, or CCSA. So I'll start off first with the daily numbers and situation that we have for you daily. At the moment, the active cases, those still under treatment in Thailand, number to 2,969. So that's less than 3,000 active cases at the moment. Current cases, those who are still being treated for COVID. For the daily numbers, today we have recorded 374 cases. This is actually a high number of cases, but the catch is that I'll inform you that this 334 cases is actually mostly from active case finding. So it's intentional that we went to find and search for those who are at risk, particularly in Samut Sakhon. So for today's number, 374, making the active case, current case now 2,969. Out of the 374, up to 321 cases were from active case finding, 43 cases from local transmission, and 10 cases from within the state quarantine system. There are 109 new recoveries recorded for today. And all in all, the whole general number, the whole cumulative number is that we have over 12,000 cumulative cases since last year and 9,000 recoveries cumulative since last year. But of course, the important key number now is 2,969, which are the current cases. We have no new fatalities. One observation from the spokesperson today is that right now the province of Pathalung has been added to the list of provinces that have found new COVID case. So therefore, there are 61 provinces now in Thailand that have been affected by COVID, with 16 provinces still free of COVID. Just some information on the case findings in Samut Sakhon. The provincial administration of Samut Sakhon announced that 335 new cases were confirmed recently, and out of this, around 311 were discovered through active case finding in a factory. And mind you that these numbers are particularly for Samut Sakhon, as different from the number that I informed you just now. This particularly in Samut Sakhon, 335. And 311 discovered from active case finding. 311 discovered from active case finding. The remaining 24 cases discovered through hospital checkups in Samut Sakhon. The province also notices that the percentage of Thai nationals being infected is higher, which signifies that the transmission in local communities are still active in Samut Sakhon. So therefore, the CCSA continues to urge everyone in Samut Sakhon to observe their symptoms and keep practicing disease control measures. Apart from the large discovery in Samut Sakhon, 39 cases were found, other cases were found in the country. 10 cases confirmed in Bangkok, a few numbers of cases found in the central and eastern part of Thailand. One information important for those residents in Bangkok, the Bangkok Metropolitan Administration would be issuing letters to high-risk groups. That's the summary of this cluster of information. So the BMA will issue an official letter to people in high-risk groups or had close contact to infected persons, requesting them to personally follow the 14-day self-quarantine measure in an attempt to lower the number of transmissions in Bangkok. And you have an infographic up there. The BMA found that some individuals who were identified as high risk still continued to go out to work or making trips outside of their residences while waiting for their test results. And I mentioned this a bit in the days past. These kinds of activities could lead to local infections, especially among family members and colleagues. And the spokesperson showed in one of the charts that he had just now about family transmission. Some families had already been transmitted with COVID from those who within their family who had COVID. So, for example, to spouses or grandparents or children. So that's very important. So BMA is aware of this risk, and these kind of activities that I repeat again, these local infections could spread especially among family members and colleagues. So by issuing an official letter to the home address of persons identified as being near or going to a risk area, the BMA hopes that these groups will follow the quarantine measures more seriously. Self-quarantine at home. Also issuing another letter to the workplace of the persons in the high-risk groups to get it to the point, to the bosses, to be frank, to bosses, to CEOs, to managers, to ask co-workers and management to strictly practice disease control measures and observe their symptoms as well, as soon as there is information that one employee has gone to a risk area. So these will be issued. The Health Ministry also announced that persons identified as in high-risk groups will now be tested for COVID twice now. The past practice was once. The first test conducted when a person is identified as high risk, and the second test will be repeated 5 to 7 days after the first test. This new measure of doubling the testing frequency will narrow the probability of falsely negative results. Another interesting information is a development from the Ministry of Higher Education, Science, Research and Innovation on the development of artificial intelligence face mask detection software, AI face mask detection software, to detect if people are wearing face masks and whether they wear it properly as well. This software uses facial recognition technology to detect if there is any obstruction to the user's face. This software can also detect the face masks in milliseconds and can also detect if masks do not fully cover under the nose or the mouth. This software can also measure the distance between people, which would reflect if the social distancing measure is being practiced. So the Ministry of Higher Education, Science, Research and Innovation is currently cooperating with the Bangkok Metropolitan Administration and the National Telecom, PCL, to access the capital's CCTV footage and put this software being developed in place. So by using this AI software, the Public Health Ministry and the CCSA will be able to analyze more on a wider scale the public behavior regarding the disease control measures if they are accurately followed, and can encourage people to continuously practice DMHTT. So in summary, this software, AI face mask detection software, will aid the CCSA and authorities in analyzing the behavior of people in using or not using face masks, particularly in congested areas in the capital, for example, face detection. So we can have that information and take the appropriate measures. And it's sort of like a technology for surveillance for congested areas, which is very important and which pose as high risks for the transmission of COVID, higher risk than in less congested areas. So just some additional points today. Of course, high number of confirmed cases, particularly from active case finding, as I mentioned. Reaching more than 300 cases, mostly from active case finding. But we would like to urge the public to remain confident, as most of these numbers are intended through active case finding. We want to search for positive cases in particular areas and bring them out, and bring them out in order to be able to treat and contain the virus in the fastest time possible. So these active case findings in Samut Sakhon provinces are the largest number for today. The local transmissions in other provinces have continued to decrease, actually. So that's good news. The local transmission in the 61 provinces that I mentioned have actually continued to decrease, and Pathalung, as I mentioned in the beginning, had only one new case found, and they are included in this list. So the authorities, the public health ministry authorities will continue to conduct this active case testing in Samut Sakhon and elsewhere to ensure that we are able to root out wherever those cases are found, even those who are asymptomatic patients who might not otherwise be found to have COVID. So we will work on this in order to avoid and not lead to widespread infection further. So as some new cases are found to be related to illegal acts, I'll repeat this, such as gambling dens, some other gray area vice, the Prime Minister has yesterday, the day before, encouraged the public to provide leading information or tip-offs or additional information and insights regarding these issues through direct contact with the Prime Minister's office, via the government's complaint hotline, website, or mobile application. And you see an infographic of all those direct hotlines to the Prime Minister on screen. And as some of the new confirmed cases have continued to expand. We mentioned the other day about drug use as well. People gathering in terms of using illegal drugs. The drugs are, of course, illegal and lethal and fatal in themselves already. But of course, the congregation, the gathering in terms of the COVID risk is also there. So it's a double risk in those gray area activities. So lastly, the Prime Minister stated that the government will urgently establish one new structure, a committee, to investigate the involvement of officials in these gray activities as well. So that's very good news. So this is all I have for you today, just briefly for today. It's a weekend, nice Sunday weekend, cool weather. I hope you enjoy the rest of Sunday. Thank you for your kind attention, and then we will see you again tomorrow on Monday. สวัสดีครับ
ครับขอบคุณนะครับท่านณัฐพานุ นพคุณนะครับรองอธิบดี